I'm called Boniface Onyango Olalo, working in Migori County as the County Laboratory Coordinator, coordinating laboratory activities. Today, I want to announce that we are launching DNA PCR viral load molecular machine for Migori County for testing HIV and other diseases. We are very proud as a county that through support from PEPFAR, through CDC, we have been able to get molecular DNA equipment that will help us in Migori to test HIV in early infants and also measure the viral load for our patients. This is a very big project that will raise Migori County to a regional level and up to international level. In fact, all the counties within neighboring Migori, Homa Bay, Kisii, Nyamira, will bring their samples to Migori for testing. Initially, we have been testing our samples in Eldoret, Ampath, and we are appreciative for Ampath, Eldoret, for accepting this work that they have been doing for us for several years. But today, we are happy that in Migori County, we are launching this equipment. So we will no longer take our samples to Eldoret. We will be testing our samples in Migori. This will help us, number one, improve our turnaround time. Initially, our turnaround time has been 7 to 78 days. This time around, now our turnaround will just be hours, up to 1 day. And this will help us in early initiation of the treatment. And also, we are able to detect the viral load of our patients that are on HIV care. And then also the third one, we are also able to test other diseases that will require molecular testing, like COVID-19, HPV, human papilloma viruses, and other diseases that might come. We'll be able to use this machine to test them in Migori County. From the day of contracting the HIV, now we just need 1 to 2 days. Yes, and we are able to detect whether you are HIV positive or not. Initially, the normal testing, we test antibodies that we test after a window period of 1 to 3 months is when you are able to detect HIV. But with molecular machine, within 1 day to 3 days, you are able to know whether you are HIV positive because it tests the DNA of the organism. We used to take our samples to Eldoret every Tuesday and every Thursday. And in a week, we were spending 50,000 Kenya shillings in taking samples to Eldoret in a week. In a month, we are spending 200,000 Kenya shillings just for shipping samples to be tested in Eldoret. And this has been going on. So if you translate that to a year, it translates to a lot of money. This one will help us save this money, and this money can also now be used to do other things. My own perspective, this is going to be a very big game changer because we are able to detect HIV within a few days, and this will help us in early initiation of treatment and care. In terms of CD4 counts and viral load, we used to collect them and take to Ampath for testing, and even Kemri in Kisumu. That could take 7 to 70 days. It could take a lot of time. But now with this machine, we'll be able to get our results within 1.5 hours. Yes, so that will help and improve turnaround time. Our patients will get their results in time, and patients management will be well improved in Migori County and even other counties that will be here. Initially, we used to take our samples to Kemri for COVID-19 testing, DNA COVID-19 testing, but now with this particular kind of a machine, we'll be able to test even COVID-19, that is SARS-CoV, using this machine. We'll just avail the reagents and we'll be able to detect such diseases. But not only even SARS-CoV, we'll also be able even to test HPV, human papilloma virus, which is a causative organism for cervical cancer. Yes, and other diseases. We have already trained staffs that are already trained to run this machine, but I will appeal to our county government also to add us more staffs so that we are well endowed in terms of staffing.
My name is Steve Adoma. I'm the lab manager in this facility, that is Migori County Referral Hospital. The machine that is just standing before me is we call Alinity. Alinity is a machine that we use to do what we call a viral load. A viral load, in a simple way, is a way of counting the number of viruses that are present in the body. And one of the importance of doing that is that it assists in monitoring the amount of viruses in the body, specifically when people are taking drugs or before people start taking drugs. Before a person starts taking a drug, we normally count or enumerate the total amount of viruses that are present in the body. And this number determines the immunity of the person. The higher the viral load, the lower the immunity of the person. So as you get initiated into HIV care, that is treatment using the ARVs, we normally do the viral load to ascertain the number of viruses that you have, and this viral load will also will be determined also whether somebody is taking the ARV drugs or not. When somebody is initiated on the drugs, the number of viral load is supposed to go down drastically. If that happens, it means that the person is adhering or taking the drugs in a way that is prescribed. Again, at the same time, in case somebody is taking drugs and the viral number, that is the viral load, keeps on increasing or multiplying, it means that that particular drug that the person is using might not be helping that person, and a change of regimen is necessary. It could be possible that you're developing resistance to that particular drug. So it is necessary to do this test. It is normally done after 6 months, before initiation is done. Then upon starting taking of drugs, it is done at month 6, then at the 12th month, which means in a year, we do it twice to monitor the system of a person, whether it's responding to the drugs well or not. And if there's a change, if there's a need to change, then we change the treatment regimen in case the viral load is, or the virus is not suppressed into the body. That is basically what it does. Again, the other one, we have the two, the one that we just come from the other room. That other one can also do what we call the early infant diagnosis. When a kid is born or when a child is born, the child has not yet developed its own antibodies. And the normal kits that we normally use that we call the rapid detector kits, this kit detects antibodies in the body. So when a child is born, the child does not have its own antibodies until a child attains the age of 18 months. So that is to say that during this 18 months, when you test the child using the normal RDTs, that is the rapid diagnostic kits, we are detecting the antibody of the mother, not of the child, because the child has not yet developed antibodies. And for that particular purpose, we need to come up with a strategy that is now called early infant diagnosis, which is a molecular method that tests the DNA of the virus. So this one will detect even to the virus in a child which is born today, because each and every person has got a DNA. So if you are infected with the virus must have developed a DNA in that particular patient. So when the blood sample is taken, now we are going to detect the virus into the blood of that person, because we are using the DNA amplification system that is going to detect it in that particular child.